Good morning, good afternoon. Welcome to the COVID Town Hall. We are ready to get started. David, if you could take down the slide, that would be greatly appreciated. Thank you. And Marco, I'm going to turn it over to you.
Thanks, Sherry. Can everybody hear me okay? All right. Good afternoon and almost noon, everyone. As I mentioned in the chat, I hope everyone's able to stay cool today in this unusually hot and humid weather across the country. I'm Marco Giordano, your CEO, and I thank you all for joining us today. It's been a while since we have last met for our COVID-19 town hall, and a lot has developed over the past 4 weeks or so since we've last met. During the past few weeks, we've seen a positive impact on the vaccine throughout the country. With an increasing percentage of the US population being vaccinated, the CDC has loosened mask requirements for vaccinated people over 12. And state and local government has proceeded to also loosen and/or lift COVID-19 restrictions. After 15 months of a new normal, we are emerging or beginning to emerge from the tunnel, looking beyond the light and looking forward to understand and adjust. This is a great thing, a long awaited exhale. I hope you all feel the same, although again, we know that there's still a challenge in front of us. As a service provider supporting people, we must carefully evaluate how we adjust our operations in this new environment. So today we will be sharing information and guidance regarding mask wearing and other protocols for our community here at RHD. And as we begin to adjust, it is important to also acknowledge that each of us will be feeling differently about these changes. Obtaining the vaccine is a personal decision, as is now wearing a mask, whether vaccinated or not, in most circumstances. The past 15 months have been traumatic for all of us. However, we all experienced the past 15 months differently, both personally and professionally. As the saying goes, we are in the same storm, but on different boats. As a trauma-informed organization, it's important that we acknowledge the impact of this trauma and support each other. We could do this by embracing our foundational value of respect for the dignity and worth of everyone in our response as a corporation, but also as individuals. Right? Our response to this new environment, incorporating our foundational value of respect for the dignity and worth of everyone. Responsibility, again, we have as a corporation as well as individuals. Along the way, we will continue to learn and understand more about the virus and the impact of the vaccine as time passes, and we will adjust our response accordingly, continuing to follow CDC guidelines. So I don't want to delay the important information that we have to share with you today. I do want, before I pass the mic back over to Sherry, thank you all again for your unwavering commitment to the people we support and each other. And I appreciate your patience as we continue to navigate this new environment together. So with that, I'll turn the mic back over to Sherry. And again, thank you all for joining us today.
Great, thank you. And David, if you wouldn't mind bringing up the agenda one more time. We have lots of people still joining. Always like them to know the outline of the day or our time together. So after the housekeeping, we are going to hear from Shayna around the admin space. Then Brian is going to give us his usual COVID numbers update. June is going to talk us through the mask protocols, and we're going to open it up for Q&A then, sort of the first portion of the meeting. And then we're going to move to a vaccine update. We're going to see a video from FPCN. And we'll open it up for a Q&A specifically around the vaccine. And we'll have Nina Morell and Lakeisha Garland from FPCN to answer questions. We do have a pretty full agenda. As always, we encourage you to send in your questions. We even got some over the weekend. Your voice, the COVID-19 inbox, and then of course our most popular, the Zoom chat. And we have Sarah and David manning all of those different things so we can take your questions. All right, David, I am going to pass it to Shayna to give us an update on the admin space.
Thank you, Sherry. Good afternoon, everyone. So with changes to mandates that are soon to be in effect or currently in effect across states and counties, Philadelphia being one of them, we're aware of how these changes potentially affect social distancing practices, mask wearing, and just overall site capacity and workspaces. And so for those who may be wondering what the next step is, when it will take place, if changes haven't already occurred within your admin space, I would just like to reiterate that we do not have any exact set dates corporate-wide as to when our work environments may change again. It is still RHD's goal to provide advance notice between 2 weeks to 30 days of when changes will occur, and to continue with a phased-in approach and planning for people to return to their workspaces. And so as usual, if anyone has any questions related to returning to your specific workplace, please direct them to your immediate supervisor. And that is all that I have. So I will pass it back to Sherry.
Great, thank you, Shayna. And I'm going to move it on to Brian to give us the COVID numbers update.
Thank you, Sherry. Can everybody hear me okay? Okay, very good. I changed workspaces at home. So, all right. So currently we've received a total of 2,792 reports since March of 2020. So of those reports, we've received 781 confirmed cases, 1,470 negative cases, 70 suspected, and 397 possible exposures. We continue to work with our divisions to kind of tie up those ends for those possible exposures and those suspected, so we can, basically come to a conclusion for their status. What I'm going to do now is, like I've been doing in the past few weeks, or past few months, I'm sorry, is I'm going to share my screen and show the chart we've been using. All right. So what you can notice about the chart, we've watched this over, several months, over a year, and you can see right now we've had much less activity over the last few weeks. Really, since, the mid-April, we've seen a steady decline in the number of reports we've received. And even then, towards the end of May, we have received very few reports towards the end of May. So, this is definitely a good trend. Like Marco said, this is definitely starting to wrap up. Hopefully, we see a lot of good things happening, and we've seen these numbers drop significantly over the last few months. So just from a national perspective, again, just kind of, again, alluding to what Marco said, the number of new positive cases across the country have decreased 48% from the average 2 weeks ago. So we've seen a lot of progress over the last few months. So my update this week is really short and pretty easy, probably the easiest it's been since the beginning of the pandemic. So with that, I'm actually going to throw this over to June. I believe that she is going to follow me up here, and I'm going to stop sharing my screen and let June do her thing.
Thank you, Brian. Good afternoon. I'm June Hodges, Director of Risk Management, and I'd like to provide a brief summary about masking. To mask or not to mask, that is the question. With all recent changes in guidance from the CDC, as well as from states and cities, the information overload may have left us feeling a bit confused and with questions. So let's review a few points to provide some clarity about the changes to help you make decisions about daily activities after you are fully vaccinated, and how to interact with those who aren't and whose status is unknown. The CDC guidance requires masks at programs that are considered healthcare facilities, particularly those where medically fragile consumers reside, or the FPCN clinics, as recommendations for use of personal protective equipment by healthcare professionals remains unchanged. Additionally, masks are recommended for congregate settings, homeless shelters, outreach programs where there may be mixed vaccination statuses. However, there's some changes from the protocols we all have been following these past 15 months. This graphic shows different situations where masks are needed or not, as the case may be. Just a minute to share the graphic. Okay, fully vaccinated people can resume activities without wearing a mask or physically distancing except where required by federal, state, local, tribal, or territorial laws, rules, and regulations, including local businesses and workplace requirements. I know some stores still require, you see at the placard at the front, at the entry door, wear a mask. So we do have to still abide by that. Clients are not required to wear masks in their own homes. If you are vaccinated and all of the staff and clients are vaccinated, meaning they are all at the same status, then you do not need to wear a mask. Staff may opt to not wear a mask at their own risk in administrative offices and may be requested to sign an acknowledgement that they've been offered a means to be safe in their work environment and have chosen not to use those items or follow recommended protocols. If vaccination status cannot be determined, again, the safest practice for everyone is to follow the recommended infection prevention and control practices, washing hands, maintaining distance, and wearing a mask. Remember, for the comfort and consideration of staff at our locations who are still concerned about COVID-19, PPE is readily available. We have a lot of stock. For those who are vaccinated, unvaccinated, and status unknown, mask, gloves, sanitizer, and accommodation for those who wish to maintain distances from others while at work should be arranged as needed. Just ask your supervisor to assist with arrangements where possible. Finally, please consult your state or funder's regulations, which may be more restrictive and/or updates, as this information could change due to subsequent updates. And it does change weekly. Thank you, and thanks, Brian, for sharing the graphic. Now back to you, Sherry.
All right, so as I mentioned, we're going to open it up for Q&A now. It could be on the topics we just spoke about or anything else, except for maybe the vaccine, since we're hoping our friends can join us at 1:30 to do a Q&A for that portion. So I do know, I think there is already one question in the chat to June. Folks want to know if the form's available. So if you could answer that out loud, June, because we know.
Oh, yes, I entered in the chat, but yes, we can send that out.
Great. And that'll go to everyone, just managers?
Yes, we can send that out to the community.
Great. So again, open up to all questions. Sarah, I'm going to start with you because I know you got a few over the weekend.
Yeah, so I got a few questions about the same subject, and I'm going to sort of paraphrase it. Staff were asking about the entry questions that were required for people to enter into a program. And folks were asking if staff or consumers are fully vaccinated, are those entry questions still necessary to ask every person in order to give them access to enter a space?
So for entry questions, the protocols, for unvaccinated people are still in place. For people who travel, those are still in place. So I believe some of the query involved, have you traveled here? Have you traveled there? And that is still in place. They have not changed travel recommendations at this time, particularly outside the country. Very important to note. And I know that some of our employees do travel in and out. So that would be probably still in effect. For those places where the staff are all vaccinated and the clients are vaccinated, then those protocols would not be advised.
Sarah, did you have another question as well?
No, the rest of the questions were about masking updates. So I think they were probably answered through June's presentation today. We did just get one in the chat. So are you saying traveling regardless of vaccination will require quarantine, or only those who are unvaccinated?
The current, that first of all, you would I don't know, I'm getting a lot of feedback here. First of all, you have to check your state's recommendations for travel. But I have checked a few of the states around here, at least in the tri-state area. And they are saying that if people are fully vaccinated, they don't need to quarantine. It's similar to the CDC's recommendation. We are not asking for proof of vaccination. We work on the honor system at RHD.
So that's all for me for now, Sherry.
Okay. And I see there's another question about will revised COVID-19 protocols be distributed? I don't know if that's just referring to masks or if there's anything else, Amanda, that you were thinking about.
I was referencing just the full presentation packet that we've been operating under, if a revised one of those will be distributed, or if that is considered no longer in effect, or that's our protocols that we're operating under. So will these changes be reflected into that packet?
Amanda, yes, we'll update that and get that out to you. Some of those protocols have gone by the wayside, but much of it is still in effect. So I think that's an excellent ask. And so we will do that. Also, while my mic is open, I'm not sure if we got the answer about visitors. So I just want to take a second to talk about visitors. If you are an RHD employee or participant and you are going to a place that is not your regular location, I'll use Marco as an example. If Marco's going out to visit a program, he should wear a mask. So visitors should wear a mask when they are going into a work site that is not their normal work site. No, hopefully that's.
Hi, Sherry. We have another one in the chat.
Excellent. Could you read that out, please?
What is the most current process for getting approval for changes in program status? For instance, allowing clients in a substance abuse program to go outside to go out to outside meetings, or allowing more people into the work site?
I'm asking, maybe I have a follow-up question, Jeff. Are you asking for a process different or aside from the return to work process?
Can you hear me?
Yes, yes.
Okay. I guess maybe I'm not sure. I guess both, because we have one site where they would like to, we do trainings there, and maybe would like to have more people in the office to allow to train more people at the time. And then also, as far as what if we have some folks that we think we can do it safely and get them to outside meetings or outside activities, can we, what's the process for saying, here's our plan, yeah, that's a good plan, go ahead with it, or make these changes?
So in hopes of answering the question, but if not, let's just hit it a little bit more. All of the protocols and rules are still in place. There is a change in the mask. You are back to work, your return to work form that was approved, that is still in effect until it is changed. As far as programs that have already been open, you're still operating under your original we're open protocols. In terms of going out, that is clearly something that varies depending on what it is. So our recommendation and hope would be, in terms of going out as in outside the building, that is the best place to be. If you are trying to engage in outside activities, or you're trying to go to the park, outside activities are encouraged and are widely considered safer than being inside. So I will say that you should keep an eye out for changes in capacity. If you have a particular situation that you have in mind, feel free to reach out to me or June, and we can try and troubleshoot that or analyze it for you at times. Maybe an accommodation can be made depending on the vaccination status of everyone, as well as the environment, the space that you're in. Again, you're going to find both June and I are a little bit looser with outside activities. So if you're trying to have a meeting outside or you're trying to be outside. And so hopefully that answers the question, but do feel free to keep at it. If not, we'll try and figure this out.
Yeah, I think maybe outside makes a lot of sense. Maybe off-site, like at another site activities, like a meeting that's held in a local church, that kind of thing. Is there, with that, it's not something we could bounce off you.
And Stephanie, if I can, maybe before you answer that, this would be a great opportunity for you to share our position around the folks that we support and any restrictions above and beyond what state, local government, or CDC would be recommending.
Okay. So Jeff, I think that was Jeff. The first part of the question, going out to other meetings and locations. Everything that we're saying about how we want to function inside RHD, we are hoping that you're applying that outside. So in terms of going into a setting, there's so many wide varieties of settings that could happen in. So you could be going at a church where everyone is social distance and requires a mask, or you could be crowded in pew to pew, person to person, where you don't, and no one has made an affirmation of their status in terms of necessary training and so forth. Leaders should be thinking in terms of the essential nature of either the travel or the activity. In terms of what Marco just shared, our participants are not at work when we are interacting with them. So we want to be really, really careful about denying our participants any kind of access or freedom that might be available to anyone else. So if we haven't been going to the grocery store with the people we work with, but now the state is open and so people are freely going in and out of the grocery store, you don't want to infringe on the rights of someone in their daily life. It's different putting a requirement for the hours that someone's working than it is to put on someone in their own home. So that's why you see that change there. If there are mixed, this is kind of like a subtle just kind of scenario that might come up. If there are mixed statuses at a residential program, the consumer remains with their right to mask or not mask. Because we are owing the responsibility, in other words, the responsibility of care and safety is something that we owe. We, on the other hand, as staff, would not be functioning in that environment without a mask. Does that make sense? And Marco, did I hit what you were talking about there with the how we interact with our participants?
Yes, you did, Stephanie.
Okay.
So we do have some other questions in the chat that are clarifying the questions that were asked. I know there are some answers in the chat, but we always try to read those out loud.
Yeah, I have one, Sherry.
Great, thank you.
So to be clear, if there are no clients coming into the office or workspace and it's just staff who are fully vaccinated, do not need to wear a mask. And those who are not fully vaccinated can opt to not wear a mask, but would need to sign an acknowledgement form regarding the risk involved. I think that's to June or Stephanie.
Okay, let me give the information in a different way, and if it generates additional questions, that's fine. We're recommending that everybody wear a mask. Let's just take the example there that it's an administrative space. Everyone should wear a mask. If you are vaccinated, you may choose not to wear a mask. And if you are vaccinated and choose not to wear a mask, you may be asked to sign an acknowledgement that you know that we don't have 100% knowledge of everyone's status. It's not something that we are in a position to verify, and that you recognize the risk, but as a vaccinated person, you are moving forward. We're asking our colleagues and friends that are not vaccinated to please wear a mask at all times.
Okay, and then I think we have another one. Says, June answered in regard to travel for visitors. The question submitted was in relation to the program entry questions for clients and staff and high-risk behaviors, vaccinated versus unvaccinated people. And the question we asked them in order to enter, do we then change our questions for vaccinated versus non-vaccinated? Have you participated in any high-risk behaviors, including but not limited to indoor dining, etc.? I believe that was to June, and she answered.
The questions are still valid.
The questions are still valid, and we particularly any travel questions too.
David, I also see in the chat, I'm trying to follow the question, but I think it's generally about how we interact with participants in terms of travel and vaccination status. And so what we want to do there is, I think maybe a kind of handy thing to keep in mind is that in the residential setting, let's separate the residential setting from any congregate setting like homeless shelter or other setting like day program. For a resident functioning in their life, you want to look at what the state and locality allow. So if the state says if you're unvaccinated to do those things, that's what the participant wants to do. Think about it in terms of rights. So if you were in that community, would you be able to do that without, getting approached or reprimanded, or would you be breaking any rules? And so that can help you run through any number of circumstances. So as June said, the travel restrictions do fluctuate all of the time and what's required. And right now, or in many cases, the recommendation is that if you want to walk through the airport without the mask, you can, but when you're on the plane, put the mask on. But remember, we're always starting from a premise as the best, most safe approach. We'd like you to wear a mask. So if the consumer doesn't mind wearing a mask and is willing to wear a mask, it is not for us to say, well, take your mask off, you don't have to wear a mask. We want the consumer to be comfortable, and they also must have the same rights that we would all have in those same circumstances.
Okay, and I believe June answered the next one, but I'll just read it. I thought we weren't distinguishing between vaccinated and unvaccinated at our programs. So I have an unvaccinated client flying to Florida next week. I'm supposed to ask him to quarantine, but me, for example, might be flying to Florida and I'm vaccinated. I don't need to quarantine.
I did answer that question. Sorry, I did answer that.
No, go ahead, June.
I answered the question in the chat. I would have to look up your state. I don't know which person asked that and what state they're in. If you are vaccinated, you don't have to quarantine. If you're unvaccinated, I'm not too sure what the state would say about that, but generally they're saying you do. So some states aren't requiring any quarantine based on their numbers. So I do have to refer back to that to answer that accurately.
And so with all of these, you have a number of places you could go for rules. So let's talk about a couple of the bigger places we can go for rules and protocols. RHD has rules and protocols, your locality. So it could be your state, your county, whatever that is. And what we're going to pick is the set of rules and protocols that provide the most safety. So if RHD says don't mask and your state says mask, then you mask. If social distancing has been abolished where you are living and working, but RHD, you're in a program where we are still wanting social distancing, perhaps there are medically fragile or compromised individuals, then you're going to do that because that would be the most protective. So just in your head, when you're feeling a conflict, try to go to the safest place. And always, as always, we're risk management, and I'm not going to take any credit from June and Brian by saying they have been always willing to answer your questions.
All right, we have a few more questions in the chat. It says, I understand changes in masking protocols. However, our policies do not address vaccinated individuals and exposure protocols where there be changes sent out to directors.
I don't follow. So we are going to update the protocols. I'm taking a shot now, David. I don't know. We'll update the protocols. Give that as a possible answer to reflect the changes. And a lot of the changes do have a ripple effect. So if that's what I'm hearing, then yes, we will be updating the protocols to comport with the new state of things.
Yeah, I think if I can speak for that person, I think because I had a similar question, I think the question would be, do you still need to report exposure if you are a vaccinated person? And will those protocols be updated in the safety protocols that get sent out to staff?
Okay, now that's a question I don't think, have we talked about that, June, Brian? So we'll take note of that and make sure we get back to you with that answer in terms of exposure. That's a pretty good one. It's pretty tricky because nothing conclusively has been said. We know that vaccine is extremely effective in terms of preventing you from getting COVID, but they are still batting things around. I don't know if anybody on FPCN is on here, may have up-to-date information about the ability to carry COVID to someone who is not vaccinated. I think that would be what the answer pivots on. But if no one from FPCN has anything more recent, then risk and the health centers will put their heads together and come up with a response. Thank you for that question.
Okay, we have a few more. Do we continue to take participants' temperatures if they're vaccinated?
We haven't really addressed the temperature taking. We had indicated that is a part of a screening process, and it was mostly for our spaces, entry into our spaces. So again, we'll be addressing that.
Okay. We have another one. 1 second. It says, so vaccinated individuals, clients, and staff have the right to go out to restaurants, have the right to go to gatherings and resume normal activities per CDC. To be clear, we are still supposed to ask them if they have eaten in a restaurant or gathered. And even though the CDC says they can do so safely, we are still saying they cannot enter a program, even when wearing a mask.
Each establishment, when you go out, they will still have, some places are still requiring masks, some are not. So, as far as mask wearing, you have to base that upon the establishment you're going to. That's part of
the question isn't about wearing masks, it's about the entry program questions. Are we still telling vaccinated individuals that they cannot enter our program if they have eaten in a restaurant? Yes or no?
I would say that if they're vaccinated, that we would not ask that question. If
okay,
it's
then
no
those
longer
questions need
part
to
of
be
your
updated.
state, I don't know what state you're in, so I would have to double check if those state requirements are still in place.
Well, those are the
not.
RHD protocols that we're trying to follow that need to be updated, the program entry questions.
Right, and we are updating them. Thank you.
Thank you.
Okay, we have one more. It says the basic protocol that seems most out of date with current CDC guidance relates to high-risk behaviors, gathering with more than 10, eating indoors, attending sports events. These behaviors are widely participated in our community since more recent guidance and have been a challenge to enforce.
So if there is, I'm going to try this in a little bit broader, more general sense, and hope that it helps us all kind of come to an understanding. You are going to have protocols that conflict. We all are on the same page that you're going to go with the safest protocol. Another question that I think is coming up and creating some frustration is, what if something about the new protocols makes something else obsolete or problematic or restrictive as far as rights for the participants? All of the protocols are going to be updated to comply and comport with the new guidelines. So if you are having a question or if you're having confusion, until you get the updated protocols, make the decision that leaves people more safe. Or if you have a question and you just don't know, feel free to ask the specific question. It is extremely difficult to ask kind of a, can we go to a restaurant without a mask? I don't know. I don't know the state, the health of the consumer. There are so many scenarios. So if you find yourself struggling, we want risk management. We really want to be there, the COVID committee. We really want to be present for you to help you work through those things, because as June mentioned, the states are all over the place. So in some places, the answer is the state doesn't let you indoors without a mask. In other places, everything is lifted. Every single protocol is lifted. And in some instances, there is actually the need to go down to so granular a level that we need to look at the health and safety of the people around us. So if we're working with people who are medically fragile, the expectation would be that you would be able to and willing to take even higher precautions. And that's one of the things that June mentioned in her presentation. So we have some things that are conflicting. Pick the safest. Where it's confusing, let us get the protocol update in your hands, and then you let us know what you're struggling with, and we will guide you through.
I think it's important to mention, David, if I can, the reality of the environment that we're working in, and I think June mentioned it earlier, it's really honor system in terms of whether you're vaccinated or not. So some programs know, particularly if it's a smaller program, whether or not all their staff are vaccinated. Some programs don't. Some programs, as Alicia or Stephanie has shared, because of the types of activities, you have a lot of visitors and or just a transient population that you're working with. So it's hard to really to understand that question, or the answer to that question, is everybody vaccinated? So again, our protocols are going to be based upon the honor system, but we're also identifying specific scenarios where it doesn't matter if you're vaccinated or not, you need to be wearing a mask as an RHD protocol. Again, the best example would be anything that we define as a healthcare setting. Obviously, our health centers is a great example, but those settings that we are supporting medically fragile individuals, doesn't matter if you're vaccinated or not, we need to hold a higher standard in those settings to ensure the safety of the most vulnerable individuals that we serve. So I do think, as you're thinking about this, remember that we're going to be working in an environment where it is going to be based on the honor system, just like we go into the grocery store. Some grocery stores today, can't even say most. I know the one I visit, this is how it works. If you're vaccinated, you're free to go in without a mask. If you're not vaccinated, you need to wear a mask. No one is questioning you whether you're vaccinated or not. And even if you're vaccinated, you still have the choice to wear a mask.
Marco, related to what you just shared, I am seeing questions about, are we going to require proof? And I know June did share correctly that it's the honor system. I think sometimes it helps though to show the work, like, the scratch paper and scribble on the back. Here's the thing. in a way, we've been fully functioning in this time frame on the honor system. We never would be able to pinpoint if you had gone on a trip. We asked you the question with no ability to prove whether what you said was true or false. And as we've been struggling, the COVID committee has been struggling with this. One of the issues is that, is it something where you show your status every day? Are we going to check around workplaces and police people in terms of their status? Do we want to create that environment where you're looking at someone with a mask and you're trying to figure out, or it's just kind of, no one cared to even discover the true nature of someone being vaccinated? This is important for everyone. And to a certain extent, we know there could be people who work around the system, say they're vaccinated and they're not. But we've been having to function since the beginning of this pandemic, counting on each other. And so that's where we ultimately landed, is that people are good, and that people will care about their colleagues that they work with, and they will care about the people, the consumers that we work with. And even if you think about what we have said in terms of always wear a mask, if there is a visitor or a contractor is coming through, we might not know that they hold our same values. But even more importantly, they may not know that where they've been, they picked up something that they could drag in. So I kind of get there is some anxiety around saying you must be vaccinated to do this, this, and this, but then we really are not going back down the path to make sure that that happens. I just wanted everyone to know it wasn't without thought, we got to count on each other. We haven't been able to figure out a better way.
Thank you, Stephanie. You answered most of the last questions. Just one more. It says, will a risk acknowledgement form be sent to program administrators? And I guess if so, when?
The acknowledgement form should be, I'm looking at Marco, should be able to go out today or tomorrow morning. So yeah, you'll have that before the next day or two's out.
Okay, and that's all the questions for the chat right now.
I just want to thank everyone. I know this is it's a very nuanced topic. It's a hard topic. We've got CDC and state, and so I think we've got a lot of more clarity around your questions. Some we've thought through, some new ones, and what I'm taking away is a clear ask to have the revised protocols. I know I saw June put in there that they're working to get those ASAP. So I'm going to hope to say by the end of the week. I don't know if that's realistic, but if not by the next time we meet, we could give a hard and firm date. So again, thanks for hanging in there. Thanks for all the questions. Thanks for our executives for hanging in with all those questions. But these forums help us get a flavor. So we appreciate them. All right, so Sheena, I'm thinking that between your vaccine update and the video, that'll take us to 1:30 when our FPCN colleagues can join us for the vaccine question. Yep, I'm getting a thumbs up, excellent. So I'm gonna turn it over to you, Sheena.
Thanks, Sherry. Good afternoon, everyone. Happy Monday. I don't know about you all, but that whole conversation kind of made my anxiety go up. So what if we just take a moment to just breathe and roll our necks around, roll your head around, stretch a little bit, just to loosen up a little bit. I think that'll be a good idea. So good afternoon. For those of you who don't know me, which I'm sure you all do, my name is Sheena McClinton. I'm the division coordinator for the BHH division. Over the last 15 months, it's been so great getting to meet so many of you, getting to work more closely with so many of you. So just one of the positives that, this last year, almost year and a half has brought us. So I'm so grateful for that. So on the update side, just gonna
You're on mute.
You're on
Sheila.
mute.
Sorry.
We heard just wanna, and that's it.
Sorry. That's in my true nature. Sorry about that. I just added my email to the chat so I don't forget later when I get to that, when I say if you guys have any questions or anything related to vaccines or PPE, which you can just state it, feel free to reach out to me. So my vaccine updates aren't huge right now. I wanted to have more numbers, more of our percentages to share with you guys for today. But when I was going over our data, it's a little outdated, so it wasn't as great to share. So when we meet next time in 2 weeks, I will have that update for everyone to see. It's nice to see those visuals and those numbers up on the screen to see how RHD is doing in terms of our vaccinated population. I just do want to give the updates. By now, I think we all know that those 12 and up are eligible for the Pfizer vaccine. So if we have any individuals we serve, we do have some children's programs, or we have some residential or shelter programs with their family involved, families there, so children there. Please make sure that you know the information, if anyone has information about that we're passing that along, that Pfizer is approved for those 12 and up who wish to get it. Right now, nationally, there really aren't any shortages of any vaccines. Everyone is pretty much able to go to the pharmacies and get them, to just different places that have them available. So if anyone does need any specific information about the vaccines and locating a place to get it, please feel free to reach out to me. And if you're not local to the Philadelphia area, I'll make sure that I match you up with the regional vaccine committee representative to get you that information. I'm losing my train of thought right now. Sorry, guys. That last discussion just kind of threw me off a little bit. And I just want to add, my favorite part of the day, no matter what's going on, is when I can get in the car or leave the store and take my mask off. My favorite part of the day. I can't wait to do that. So we will be having some guests from FPCN, as Sherry mentioned before, Keisha Garland and Nina. I don't know Nina's last name. Will be joining us in just a few minutes. Before that, I'm going to share a video that SPCN created and put out. This was sent out, this was distributed to all staff last week or the week before, so you may have seen it already, but it just gives some updates around the vaccine and answers some questions around why some people chose to get the vaccine. Now, if there's, we do want to hear more experiences. We do want to, from our staff, from our RHD community. So if there are any RHD employees out there, if anybody at your program who wants to share, please tell them to get in contact with me, because we do want to hear some of your stories, so we're able to share them with our larger community. Okay. Thank you, Emily, Nina Morel. I don't know why I never knew her last name. So I'm gonna share the video right now. Share screen.
I was leery about getting the vaccination. I needed to do something so that people who trusted me, because I look like them, because they know me, because I treat them, would at least have someone who they knew who got it and who was okay.
I think it's really important to validate and acknowledge the history of trauma that Black and Brown folks have experienced within the healthcare system in the United States. This mistrust is not new. It is one that is steeped in experience. Over time, Black and Brown folks have learned that their bodies are disposable, or that's the way they've been used, as disposable. And so it makes sense that people wouldn't necessarily be willing to assume positive things about the vaccine, from Tuskegee to Henrietta Lacks to the history of gynecology. And even now, looking at the Black maternal death rate, we can see that racism is still alive and well and operating within our medical systems. And so it's really important to create spaces where people can have their questions answered candidly, even the ones where there are no answers at this time. It's important to be able to do so without stigma. It's important for them not to feel judged. And ultimately, if that means that they decide not to get the vaccine, we need to create spaces where that is an option.
Doing this for the community, doing this for the family, for my baby girl, and for everyone to know that we're in this together. And we're done. Second one in the books.
Hola, me llamo Fernando Ríos. Yo trabajo aquí en 11th Street. Yo cogí los 2 vacunos para mi familia y para la comunidad.
So I gratefully received my first dose of the vaccine a few weeks ago, along with 2 family members. I always planned to get the vaccine as I believe in the science behind vaccines. And to be honest, I was okay waiting a bit to see how people were responding to the vaccine. However, as infections and deaths were increasing, and I felt like I didn't really want to be left behind and miss my chance to stop the spread of the virus.
All right, here I am about to get this second shot. Second COVID shot. It's fine. And I wanted to make sure you wasn't experienced. It's a done deal. So trust science. Get the COVID shot if you can. It's a blessing. All right, peace out.
Personally, I did decide to get vaccinated, and that decision came about after much research, soul searching, talking to friends and family, talking to trusted professionals, and really reviewing the data for myself and asking myself some hard questions. Did I trust this information? Did I have a clear understanding? Was I able to manage my expectations? Yes. And so when I went in to get my dose, my first dose, it was with a clear mind and a clear heart. And I hope that that is the experience that anyone who decides to get the vaccine is able to have, that they go in willingly with a clear mind and a clear heart and know that they're making a decision that feels best for them.
Please, people, consider your situation. Consider this thing is silently killing our community, and it's affecting our community as much, if not more, than any other community. We're dealing with conditions that are so harsh and extreme. Take it upon yourself, get the information, get what you need, make a clear decision based off of the betterment of our community, betterment of our people, and then think about yourself and the good you're gonna do.
I must admit that I too was very skeptical at first, but once I had an opportunity to examine the data and speak to medical professionals, along with friends and colleagues who have already received the vaccine, I was able to make an informed decision to get it. I strongly encourage everyone, if you haven't already done so, go get vaccinated.
Medical racism is real. One of the core pandemic dilemmas is this: the very communities most justified to be suspicious and distrust medical providers and the scientific communities are the very same people who are dying at a disproportionately high rate. Black and brown communities deserve the space and the representation necessary to dialogue on this paradox.
Hola, me llamo Jasmine, trabajo en el departamento dental en 11th Street. Recibí las 2 vacunas y la razón por qué lo hice para mi comunidad y para mi hijo.
I particularly wanted people that I worked with, both staff and clients, to know I got vaccinated and to be able to hear about my experience with it. I hoped my willingness to do it might give those who trust me confidence in something that could be life-saving for them and their loved ones.
So I just want to thank, again, SPCN for creating that video and continuing throughout the entire pandemic and partnering with us and sharing their resources sorry, guys.
So Sheena, do we have Lakeisha and Nina on?
Yes, I'm checking to see.
Okay.
Lakeisha and Nina, are you on?
And
Yes, we're here.
Here.
yes.
Okay. So
All
thank you.
right.
So at this point, you guys can ask questions. I'm going to turn it over to Nina and Lakeisha. Thank you so much for joining us.
Hello, thank you, everyone. Lakeisha, I don't know if you wanted to start.
Well, just hi, everybody. Hoping that everybody's doing well. Thanks so much for featuring us. Just to spend some time to talk to you a little bit today about our COVID vaccine efforts. So, you know, the good news is that we do have the Pfizer vaccine. We have our hands on it now. And there may be some questions that we'll be getting to going forward, but we'll be able to vaccinate families. So, you know, adults, of course, but also children starting at the age of 12 and older. And so, you know, I'm not sure, Nina, Sheena, if there were any questions that folks may have posed prior to today's town hall. You know, Nina's here. You know, if we could go ahead and, you know, just ask those questions, and Nina, with her wonderful clinical expertise, can answer them.
Sherry just added that those who have questions can put them in the chat. We did have one about, will FPCN be holding any more clinics? So I guess you guys can answer that. If you guys have the dates of any further clinics you guys are planning.
Okay, so this Saturday, we'll be back at Ezekiel Baptist Church. We're going to be doing a booster clinic for Moderna, but we're also going to be bringing Pfizer along with us, again, to vaccinate families and children starting at ages 12 and up. So that's this Saturday, June 12th at Ezekiel Baptist Church. I can send you the information, Sheena, so that you can just burst it out to teams there from 10 to 12 or longer if we need to. So that's this Saturday. And then on June 26th, we are partnering back again with Triumph Baptist Church. We'll be doing a community grab and go event. So it's going to be a family event. You know, we'll have resource tables out and about. We'll have music, we'll have food. We'll also have COVID vaccines there as well. So again, that's June 26th. That'll be from 11 to 2 p.m. And then Nina, if you want to talk about the teen clinics that will be rolling out at ABS.
Yeah, so there's availability daily at ABS for scheduling of the vaccine. So any one of the 3 vaccines, if anyone is interested in, you can get those here by appointment. For the Pfizer vaccine, anyone 12 and up is welcome to come with the parent or guardian and be vaccinated. We have a schedule open Monday through Friday. You just call into the call center, and right now the wait time is about around 4 or 5 minutes to get through to an agent, and then you can get scheduled, you or your team scheduled for the Pfizer vaccine on site.
And this is specific, obviously, to the Philadelphia area. So those of you who may not be familiar with FPCN is our network of health centers in the Philadelphia area. So for those people who live in the Philadelphia vicinity, and you get my email specifically for the Philadelphia vicinity, I will send out this information via email. Okay, if there's anyone who's outside of that vicinity who maybe does not get those emails, please reach out to me and I can make sure that you get the email as well.
And I think as of now, the residency requirements for the vaccines have been waived at this point. We're just trying to get as many people vaccinated as possible. The demand has seemed to have gone down for many reasons we discussed before, and there are multiple providers now that are vaccinating, so there's more availability of the vaccine, so we don't have those restrictions as we once had before.
We have a question in the chat for people who have had both doses. is there a recommendation for a booster shot? And Lakeisha, I did notice you used the word booster, so it got me curious as well.
Yeah, so as of now, there's no recommendation for any boosters. The only boosters we have are the second doses for those mRNA vaccines, which are the Pfizer and the Moderna, a few weeks after the initial dose. But there are no plans. We haven't heard anything yet in regards to requiring like a yearly booster, like how we would for the flu vaccine.
So Nina, does that mean if somebody got their first shot somewhere else, they could get their second shot at FPCN as long as they can tell you what, if it was Pfizer or Moderna?
Yeah, so we would just need to know the date that you received your vaccine and what vaccine you received. That'll help in our decision making on whether or not you even need a second shot. The recommended time frame for efficacy is actually 42 days, which is 6 weeks. So anything after 6 weeks for after the initial dose, there's no evidence as to whether or not the booster is even efficacious. So that's something else to consider. We would definitely still vaccinate people who want to be vaccinated outside that time frame, but there's just no evidence that you get that full protection, the 95% protection.
And I'm not sure if Stephanie is still on the call. I know earlier in our discussions, there was a question that came up that she said maybe the health center could answer when they get on, or if anyone recalls what that
question. Not at all.
Okay, I think it was something around the
Stephanie,
spread.
Yeah, it was about if people are vaccinated, what is the data saying about being able to spread the virus?
Thanks, Emily.
Sure.
So I think initially there was some question as to whether or not vaccinated people still spread the virus, but I think with the most recent data is that they think that that's slim to none, that people who are fully vaccinated will spread the virus. And that is why they've come out with the practice now that you can go without a mask and be around other people who aren't, who are vaccinated without wearing a mask.
We have one more question in the chat. It says, has there been any indication that a third shot will be required for certain people with vulnerable autoimmune conditions?
Yeah, no, so I think that's where people were speaking on like a booster, an additional booster shot or a third shot. There's no evidence as of yet that that is going to be something that's going to be required or indicated in the near future. But things are changing daily, so it may be different tomorrow. But as of today, there's no recommendation for anyone for any reason to have an additional shot, a third shot, because we've already been getting requests for people to be put on a list for September for when people anticipate that there may or may not be, it may be indicated. So as of now, knock on wood, praying that there's no indication for it, but yeah, no.
We have another question. Are there any plans for the vaccine to be used later for those under the age of 12?
So there's still some research that's being done on those younger than 12. So that's still to come. I know for the Moderna vaccine, there's been evidence that their vaccine is effective for those 12 and up as well. So probably in the next month or so, the FDA and CDC are going to move forward with approving the Moderna vaccine for emergency use for those who are 12 and older, but not enough data yet collected on whether or not it'll be for those younger than 12. I would be very excited if it did move to those ages, because as you know, if you don't know, I have 4 children, 2 of which are preteens, so they received their first Pfizer dose this past Friday. And then I have 2 that are 7 and 9 who are not eligible for the vaccine. So I'm still very, very concerned for their safety. And I don't know if you've seen on the news recently that there have been increased hospitalizations of those younger than 12 who haven't been vaccinated. No deaths reported yet, thank God, but increased hospitalizations into the intensive care unit, which can be very traumatic for a young child and even, the family as a whole. So whatever we can do to prevent that from happening, I'm hoping it does move to those 12 and under, but not enough research yet.
And I just want to ask a question. So initially when, we were waiting for Johnson & Johnson to get approved, everyone was excited. It's one shot, one and done. And then we all know we had to pause. Can you speak to kind of just, the safety concerns around that and, the current status of J&J?
Yeah, so actually there was only like a 10-day pause on the J&J, and it was reevaluated and found that the vaccine's effectiveness outweighed any potential threat. What happened was there was a small group of women who are under the age, I believe, of 40 or 50 who develop a syndrome where they develop blood clots and had low platelets. And this condition is very, very rare. So out of 8 million people who were vaccinated, 15 people developed this condition. Only most of them were hospitalized. I think a couple died. Some were released without any complications. But we're saying like 2 in a million chance of this happening. Like you have more chance of getting struck by lightning or getting hit by a car, or, dying in a car crash than you developing clots from this vaccine. So it was seen that the effectiveness of it, of not getting COVID-19, outweighed the risk of, 2 in a million of developing this condition. And as we spoke of before, post-COVID syndromes, long hauler syndromes, all these things we're trying to prevent. The vaccines are still safe and effective for preventing all these things and preventing COVID. So for anybody who's questioning whether or not to get which vaccine, you just have to outweigh the risk versus the benefit. I would say if you're a female and you're considering getting the Janssen, you just have to be aware, just anybody in general getting the Janssen, of the potential for this syndrome and to know what to look out for. So shortness of breath, leg pain, chest pain, abdominal pain, those kind of things shortly after, 1 to 2 weeks after receiving the vaccine, and then making sure you're following up with your provider. And again, it's like a 2 in a million chance of this developing.
Nina, that's making me wonder, and I hope this is an okay question, if there are a couple myths that you could address. I don't know which ones are the hot ones, this week, but are there any that you think would be good to address now?
Yeah, there's still one that kind of bothers me because a friend of mine has teenage kids, and I'm like, we have this vaccine. All of the adults in our family have received the vaccine. I'm like, now it's time for the kids to get it. And she's like, well, I don't want my kids to be sterile in the future from getting. I'm like, what? But she championed for every adult in her family to get the vaccine. I'm like, where did this sterility question come up? So that's actually definitely a myth that these vaccines cause sterility. There were several women who were in these studies that didn't know they were pregnant while they were in the initial studies, went on to get their second vaccines. Nothing happened to the infants. And there are women who definitely got pregnant after receiving both doses of the vaccine. So there's nothing on either end from men or women from these vaccines that indicate that they cause sterility. So that's the main one. Another one is that, if you're pregnant, you shouldn't get these vaccines, and you definitely need to be vaccinated when you're pregnant, because we know the outcomes of not being vaccinated, of women being hospitalized and having increased risk for death. And then you have a newborn infant that's left without a mother. So, but those are like the 2 big ones that I've come across recently.
Great, thank you, Nina. Sheena, did you have any others? Just to and give one more shout out. If you have questions, please put them in the chat now.
Yeah. And Sarah, did you get any questions? I think so.
I just wanted to add one more thing. I'm sorry.
Sorry, I haven't gotten any.
We do have a homebound vaccine program here at FPCN. So if you have any residents who are homebound who need to receive the vaccine, and it's any of the 3 vaccines, whichever one is the preference, you can have your people send an email to vaccines@fpcn.com, and that way we can get them on the list.
So those people who live in the, again, like this Philadelphia area.
Yes.
And I will, again, and thank you, Emily. Emily just put that email address in the chat. When I send out more information about some upcoming clinics, I will have that information in there as well.
All right. Oh, go ahead, Nina.
No, I just want to clarify for homebound, it's usually people who can't leave the house or usually don't leave the house for any reason. And also their family members. So if you have a family member of someone who's homebound that wants to receive the vaccine, we'll vaccinate the whole family right then and there.
That's excellent. Thank you so much. And thank you both for being here today. We'll continue to take questions and have you come back from time to time. And I am going to turn it over to Marco for closing remarks.
Thanks, Sherry. Thank you again, Lakeisha, Nina, and Sheena for your continued leadership in our vaccine efforts. I really appreciate the information that's been shared with the community to keep us as current as possible, not only to the science, but also the opportunity in the Philadelphia area for our staff, the folks we support, and our families to get vaccinated. So thank you for all that insight shared. You know, and Sheena, I got to applaud you. I know we did so in the chat for asking us to take a moment to exhale and stretch and twist our heads around a little bit, to loosen up, because the conversation we had earlier around masking can be difficult. Can be difficult for each of us to begin to understand, what do I do? How do I approach it? But then also take our own personal feelings and anxiety around masking or not masking into consideration. So I appreciate, Sheena, you taking us down that path and asking us to take that moment. And, you know, I would encourage folks to continue to do so as you are unpacking what we've shared with you today, and as you begin to receive the more formal communication of our protocols and guidelines that we'll be sending out. Have patience with us, as to it will take us a minute to be able to update all of our protocols, but we will be communicating out the information that was shared today in terms of the thought process that we are asking folks to follow as you're beginning to navigate this new environment. Remember that we are, as Stephanie reminded us, we continue to work on the honor system, and we have been doing so throughout this whole entire pandemic. And, you know, we need to continue to do so. And if we keep in front of us our foundational value of respect for the dignity and worth of everyone, along with maximizing health and safety for each other as well as those that we support, I think no doubt we can all make the decision that feels to be the best decision for the folks that we are engaging with every day or in the moment. And I think that, you know, that process, that decision-making will have other variables that need to be considered along the way. But considering those 2 factors will lead us down, hopefully, the right path. And know that when there is question about where to go and how to approach it, that resources are available to work through any scenario and question that may surface. So with that, again, I ask for your patience as we continue down this path together. And I ask you for continuing to share your thoughts and your voice so we can address what needs to be addressed as we go as well. I do feel, and I know others may not feel the same, that if we're not exiting the tunnel, we're very close to it. We're looking at the light in front of us, we're looking forward, And hopefully together we'll all be able to support each other out of the tunnel and getting beyond what we're feeling at this moment. So thank you all for your participation today, and hope to see you all back again in 2 weeks. Have a great day, everyone.